Today we're going to be diving into Finding Nemo. Before we do that, we need to know what root canal treatment is. Root canal treatment is needed when the nerves inside your tooth are dead or dying. So now that we know that, let's dive back into the action.
Can't hear you, Peach.
I said we got a live one.
Move aside, I want to see what's going on.
Root canal, and by the looks of those x-rays, it's not going to be pretty.
Rubber dam and clamp installed?
Yep.
Pause. There's no rubber dam and clamp installed. Just look at him, there's no rubber dam there. This is what rubber dam looks like.
What did he use to open?
Gator Glidden drill.
Wait,
It seems to be
Gator
failing that
Glidden
one
drill?
lately.
I think you're referring to the Gates Glidden drill. Gates Glidden drill is used for widening up the orifice into the root canal.
Oh, I can't see, Flo.
Now he's doing the shoulder technique.
Oh, he's using a hedstrom file.
That's not a hedstrom file. That's a K-flex.
It's got a teardrop cross-section. Clearly,
Chill
a
guys,
hedstrom.
chill
No,
guys,
no,
it's just a file.
K-flex.
Hedstrom.
K-flex!
Well, okay, so we've got on the rubber dam, we've got on the clamp, he's opened up the access into the tooth. So that sounds like the extirpation, the first part of root canal. And now he's going in with some files. There might be H files, there might be K files. We're not sure. There's no way that you can actually see the cross-section from a little fish tank. That's kind of ridiculous, but that is kind of how you identify them. You look at the cross-section of the files. So hedstrom files actually have a round cross-section and K files have a square cross-section. Hedstrom files are used for scraping and widening up the canal of the tooth, whereas K files can also be used for widening up the canals, but they're not as aggressive at it. But they're really good for navigating all the way down the bottom of the tooth, which is what you need to do to measure the tooth.
There I go. Little help over here.
I'll go deflate him.
All right, go ahead and rinse.
Wait, he's already done. Feels like we've missed a few steps here, guys. He's gone in with the files to clean out or shape the tooth. So we're assuming that he's in stage 1 because he's opened up the access. We're not sure if he's done stage 2, so chemo-mechanical debridement. We didn't see him use any hypochlorite to flush out the inside of the tooth and disinfect it, but he did use those files, and those files can be used for mechanical cleaning and widening up the roots. And then it looks like we've done a bit of a time skip.
1 hour later.
He could have done the whole thing in one appointment, but I think maybe he's just done the extirpation and just gone in with the files a little bit, maybe chucked a temporary filling on there and got the patient out of pain so that next time he can come back and finish off the chemo-mechanical debridement and then complete the obturation, fill up the inside of the tooth and then fix up the top of the tooth.
Ugh, the human mouth is a disgusting place.
Hey, Nigel.
What did I miss? Am I late?
Root canal, and it's a doozy.
Root canal, huh? What did he use to open?
Gator Glidden drill.
He's been favoring that one. Hope he doesn't get surplus sealer at the secondary portal terminus.
Surplus sealer at the second portal terminus. What does that mean? So it could be that he's referring to the obturation stage, so the filling the root stage. That's where you put the root filling into the tooth and there's a bit of a sealer around that to really seal up that space nicely to make sure there's no gaps. Actually, it's not a big deal if you get the sealant out of the tip of the tooth because that sealer is actually biocompatible and the body can just kind of naturally break it down and there's no real issues. What you need to be careful of is if the root filling itself is protruding out of the tooth because the body doesn't tolerate that as well, and then there can be some inflammation around that which can lead to early failure of the root canal.
Hello? Who's this?
New guy.
The dentist took him off the reef.
Alright, and we're back. So, in conclusion, watching this as a dentist, there's a few things that don't really add up. It could be that Dr. Sherman, the dentist, is just really dodgy. But in the end of the day, it's a kids movie and it doesn't have to make sense. I think the movie's done a really good job in capturing the overwhelming feeling that some people can experience when they go to the dentist.